first I'm going to check the patient's chart. I'm going to gather any supplies I need. I'm going to go ahead and wash my hands, put on any PPE that I would use. Go ahead and enter the patient's room. Knock, knock, knock. Can I come in?
Yes.
Hello, I'm Libby. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth?
Tori Witten, 5293.
Fantastic. So today we're going to do an assessment, a few different assessments. Should take about 10-15 minutes, not too long. Do you have any questions?
Not at all.
Okay, so I'm going to ask you a few questions here. What would you do if your house was on fire?
I would run outside.
Good. Do you remember what you had for breakfast?
I had a veggie omelet.
And when was the last time you were in the hospital?
Probably about 2 years ago.
Great. Do you know what year it is?
In 2020,
Do you know where you're at?
I'm at the doctor's office.
And do you know why we're here?
We're going to do an assessment today.
Okay, yes we are. So, I'm going to check some cranial nerves here. I want you to go ahead and shut your eyes and hold a nostril over, or hold a finger over your nostril. And I'm going to put something under your nose. Go ahead and tell me what that is.
Peanut butter.
And go ahead and hold a finger over your other nostril. Smell that?
Peanut butter.
Fantastic. Okay, you can go ahead and open your eyes. Now, I'm going to shine a light in your eyes. Just look at my nose. I'm just going to see if they dilate here. And they actually constrict, which is what they're supposed to do. Now I'm going to have you follow my finger. Just look at my finger and follow with your eyes. Don't move your head, okay? Checking 3 different cranial nerves here. All right, go ahead and shrug your shoulders. Go ahead and stick your tongue out. Say ah. Go ahead and keep your tongue stuck out and say light, bright, and dynamite.
Light, bright, dynamite.
Go ahead and raise your eyebrows. Smile. Go ahead and show me your teeth. All right. I'm going to give you 3 words here, and I want you to remember them. I'm going to ask you in a little bit what they were, okay?
Okay.
Dog, cat, mouse.
Dog, cat, mouse.
Dog, cat, mouse, all right? Now, I'm going to do a whisper test, so I'm going to stand behind you, give you 3 other words, and I just want you to repeat them back to me, okay? Put one hand over your right ear. There you go.
Paperclip, peanut butter, beer.
Fantastic. I would do the other side if we had room over there. Now, I'm going to check your movement, so I'm going to have you go ahead and stand on up here. Good job. Now, I want you to go ahead and stand over here, and then I'm going to have you do a heel-to-toe test. So just put your heel on the top of your toe and walk down the rug and then walk back, okay? Balance looks good. Gait is smooth. Fantastic. Now I just want you to stop, and you can turn around. Close your eyes. Great, balance looks good. Now, I'm going to have you go ahead and sit on the bed there again. I'll help you down. Wonderful, great. Okay, go ahead and squeeze my fingers here. Okay, go ahead and push against my hands. Go ahead and push against them again. We'll do the same thing with your legs. Pull against me, push against me. Wonderful. Okay, so now we're going to move on to the heart. Your heart is located, the base is on the right sternal border, apex is in the 5th intercostal space. Now we're going to check the 5 pulses. We're going to check some pulses. Got your temporal pulses here. We're going to check the carotid pulse one at a time. Check your radial pulses, brachial pulses. We would check your femoral pulses, and then we'll check your popliteal, posterior tibial pulses, and the pedal pulses if we were going to touch your feet, but I am not. Now I'm going to listen to 5 different spots on your heart. So first it'll be the aorta, pulmonary, Erb's point, tricuspid, and mitral. Fantastic. Heart sounds good. Do you feel any tingling in your fingers or anything?
No.
Nope. Okay. We've checked. We actually are going to do a little feeling test here. So I'm going to have you tell me if this is sharp or dull pain. Okay. Go ahead and close your eyes.
Okay.
And what does this feel like?
Sure.
And what does this feel like?
Dull.
And now I'm gonna put it in either 2 spots or 1 spot. Just tell me if you feel it in 2 spots or 1 spot, okay?
Okay. 2 spots.
And this?
1 spot.
Fantastic. Pain sensation is good. Balance and movement are good. There's no paralysis. Color is a nice tan pink, which is good for the race. The temperature is warm and with no extra sweating. No edema, since it's 0 on the edema scale. Go ahead and give me a finger here. Check the capillary refill. Great, comes back within 2 seconds. Now we're gonna go ahead and just a little education. The S1 is the closing of the AV valves, and the S2 is the closing of the SL valves. Now we're gonna move on to respiratory. So, chest looks symmetrical. You're not stressing out while you're breathing. It doesn't look, your face doesn't look like it's in distress. You're not using any accessory organs, which you shouldn't. We're gonna go ahead and move on to the back here. Spine is center and symmetrical. I don't see any noticeable swelling, lesions, anything like that. So I'm gonna go ahead and palpate 18 different spots back here, so just bear with me. And they're giving me a nice, clear, hollow sound, which is what we want for lungs. Okay, now I'm gonna put my hands on your back. I'm just gonna feel around for any lesions, masses. Do you feel any pain or tenderness when I do any of that?
No.
Okay, I'm gonna have to take a big breath in and let it out. Chest expansion is equal on both sides. And then I'm gonna place my hand on 10 different spots. I just want you to say the word 99 every time I move my hand, okay?
Okay.
Go ahead and start.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Fantastic. Now I'm going to listen to 18 different spots. And just take a deep breath in every time I move the stethoscope, okay? You can go ahead and start. Fantastic. Okay, I'm gonna move to the anterior side and listen as well. 10 different spots on this side, okay?
Alright.
Just take deep breaths again. All right, and in case you're curious, you've got 5 lobes in your lungs. On the right side, you've got superior, middle, and inferior lobe. And then on the left side, you have the superior and inferior lobe. Okay, now we're gonna move on to the abdomen test. So I'm gonna have you go ahead and stand on up here. Hold your shirt up. All right, I don't see any distension. It's flat, I don't see any lesions, anything like that. You can go ahead and lay on down there. I'll have you down on the bed. Okay, laying down, I don't see any hernias, striae, anything like that. And now I'm going to go ahead and listen for any sounds. I'm going to start in the right lower quadrant and listening for bowel sounds. We'll start here. Good, and just breathe normal, you're doing great. Is there any pain or tenderness anywhere in your stomach? Okay, I'm going to go ahead and palpate here from 4 different quadrants. Just do this. Let me know if you feel any pain. Okay, and over the intestines, it's giving me a nice tympanic sound, and over the organs, a nice dull sound, which is exactly what we want. Now I'm going to go ahead and palpate. Let me know if you feel any pain, okay? Okay, any pain there?
No.
Fantastic. Now I'm going to have you go ahead and sit on up. And do you have any kidney pain that you know about?
I do that.
Okay, I'm going to go ahead and just hit my hand against my own hand. Just let me know if you feel any pain, okay?
No.
Any pain there?
No.
Wonderful, you can go ahead and put your shirt down. And we are done. Do you have any questions?
I do not.
Okay, then I'm gonna go ahead and step on out, and they'll be in to let you out soon. And I would close the patient's door here. I would step back in and thank you for letting me see you today. And then I would step out and close the door. And then I would take off my PPE, wash my hands, and document all of my findings.